If you wondered what you can do, what you will be able to do 2 weeks after the open heart surgery, this video is for you, because this guy over there will perform some nice breathing exercises routine that may be very helpful, and I will take you through that step by step. Like in each video with exercises, I need to say whatever works for me may not work for you because of the overall health condition, because of the age, because of the regeneration differences, because of the medications, because there are different kinds of heart surgeries. So whatever works for me may not work for you, may even harm you. So that's only the suggestion, what may be possible, but always consider yourself in this equation. If you have any doubts, ask a physiotherapist or a doctor if those exercises will work for you. As you see, I didn't start with the bulbulator like in the first video, simply because it became too easy. It's not a challenge anymore, so there is no point in doing that. Now I jumped straight to the diaphragmatic breathing, which you can see right now. So obviously diaphragm works in every kind of breathing. If you breathe through chest, it works a bit. If you breathe through the lower chest, it works a bit. But by breathing to the belly, by stretching the belly with your breath, you move the diaphragm in full range of motion, like you wouldn't do in any kind of other exercise. Every breath in, 4 seconds a breath, I push as much air as possible to the belly, I stretch that nicely, and here I feel those limitations that were caused by the drains, because the drains that I had, they were crossing the diaphragm, so it feels nice to mobilize that. But obviously, if with every repetition the abdomen area, the diaphragm, feels better, awesome. If with every repetition the pain would increase, that would be a red flag. That would not be the exercise for now. So always consider that. If it's getting better, if you feel lighter, more movable, perfect. If you feel increasing pain, that's the red flag. You push too much. Okay, so breathe in, stretch at the top, hold at the top, breathe out, and at the bottom here, I really try to do the vacuum. So I really want to squeeze this belly button to the spine. And what does that do? It makes the diaphragm to move very high in my chest. And it also massages my abdomen, my belly. That has a pretty relaxing effect. You produce serotonin, the hormone of happiness, in your gut, in your intestines. If you massage them, you have a pretty nice shot of happy hormones. And this type of breathing I was recommending for a lot of athletes that had problems with falling asleep. Whenever I was recommending that, they were telling me that, wow, like I do it 3 minutes and I'm out. Regarding breathing through the different areas of the body, breathing to the lower sides of the chest may be also helpful, but honestly I didn't have that much time to do that, and this exercise, even though it may be helpful, it was not a priority, so I moved straight to breathing to my sternum. When I was breathing, I tried to bring sternum as high to the ceiling as possible. I was looking for a nice stretch, but in this exercise, I still felt some degree of instability at the top, even some clicking, which is not a good sign. That is why, even though I was breathing to the sternum, to the front side, I didn't breathe in to the fullest. I didn't push to get this sensation of instability and clicking. I was using only the range of motion that felt nice. Towards each direction, I was breathing for around 5 minutes, so 5 minutes there, 5 minutes there, 10 minutes overall, and afterwards I moved to much more challenging breathing exercise that that I was not able to do before the surgery, which tells me that the surgery already helped, already improved some parameters. And what I will talk about now is so-called Wim Hof breathing. Wim Hof, because he kind of gave a patent, explained that the best, and this exercise is about quite intense breathing exercises that are meant to accustom you to the very high levels of carbon dioxide. That's supposed to improve your breathing quite a lot. That's supposed to balance your stress responsible nervous system and relaxation responsible nervous system. And as I said, these exercises are very intense. I would recommend anyone to do only one set of those in the beginning and see how you will react. One more time, those exercises harmed me before the surgery, so it's not a good idea for everyone to do those. But I already tried. I did one session of one set. The next day I did 2 sets, and during this session I will go for 3 sets. So what these exercises are about, how do they look like? There are rules which are about not moving, absolutely zero movement in between sets. So try to avoid moving your head, try to avoid sitting up, moving around. You try to lay down motionless. And you start with doing very quick breaths in, breaths out to the point where you feel lightheaded, to the degree that you feel comfortable with. Then, when you feel that you are lightheaded, you take a very big breath in and you hold it for as long as you can. Then, after some time, when you see that you cannot hold air for any longer, breathe out to the bottom and hold it there if you can for a little bit more. And then relax and breathe normally when you cannot keep the air anymore. And take 1-2 minutes, whatever you need to recover from that set, and then do it again. Then recover and then do it again. As many sets as you are able to tolerate. Obviously, start easy and then slowly move forward. The results that I see in this training is that my ability to hold breath is much longer. It's improving very nicely from set to set, from day to day. Obviously, there are worse days, but overall, I see very nice improvement, which tells me that the health of my cardiovascular, my breathing system, my pulmonary system is getting better, which is what I want. And consider those exercises as a bit more intense workout for the lungs. I still feel from time to time the shortness of breath, which is not a very nice feeling. And I'm sure that this exercise helps for that. And it helps to slow down your breathing, because the more accustomed you are to higher carbon dioxide, you don't rush with breath so much, which means that you are overall more relaxed. Okay, that's it. Those are the exercises. This is my routine. This is what I do on the second week. On top of that, just walking. Honestly, doing a video about my cardiovascular training would be very understimulating, because 2 weeks after the surgery I was able to walk only for around 1 kilometer and some gentle stretches. That's I will do the video about, because I find this helpful, those low intensity stretches. And regarding the strength trainings, really, no dumbbells, no squats, nothing. I don't feel that's a good idea at this time. I feel that it's too early, that doing those will use my energy, that in a not most efficient way. Overall, I feel great. I have some degree of energy to go for a walk, to play with cats, to read a book, to play Witcher, to talk with people, which I really appreciate. But doing more really pushes me back, and there is no point, really. So, yeah, that's it. Hopefully, it helps at least one person. If it helps one person, I'm happy that I did it, that I did this video. And enjoy the exercises. Pump this diaphragm.